Okay, so now we're going to go through another common interview question. Why not nursing or another healthcare profession, for example, a pharmacist or a biochemist within the hospital? This is a question to test your knowledge of other members within a multidisciplinary team. It tests what you know about their roles and the differences when you compare that to the role of a doctor. So it's very important to know the differences and then compare and say why you prefer to practice medicine as a doctor. It's also important to appreciate some similarities of the two different professions and the importance of all healthcare professionals. Without one or another, the team would just simply be unable to deliver good quality care to patients, and it wouldn't work as effectively. And so healthcare professionals must work coherently as a team. Different professionals will have different levels of experiences and different competencies for their roles, and they will often involve more or different training and career progression. All careers in healthcare can be both challenging and demanding. Now let's go over the differences and what to say in a way that will let the interviewer know that you lean more towards medicine while still appreciating the other roles. So first we will compare the role of a doctor and a nurse. As a doctor, you will often be involved in the diagnostic aspects of patient care, which will involve ordering investigations, prescribing certain medications, and managing patients' treatment plans. As you may be aware, certain nurse practitioners can also prescribe with appropriate training, but in general, they're more involved in the continuity of care of a patient. This may involve providing comfort for patients, monitoring patients' observations, education and informing patients and their relatives, administering medication at the correct time, dose and method, and they're also involved in the day-to-day care on the ward, and they'll often be the ones who know patients best in the hospital. More often, doctors will involve a longer training pathway to specialise, which will involve longer time spent developing yourself and learning new information, whereas specialism in nursing is more specific and earlier on, and it can be limited in certain circumstances. Doctors will involve a leadership role for decision making in the patient's management plan, whereas nurses can be more protocol driven in this area. For example, once an abnormality is detected in a patient, such as a spiked temperature, they will often need to inform a doctor about this and see what kind of treatment can be provided for the patient. That being said, leadership is still a huge part of nursing, as with seniority, nurses will have to lead other nurses and staff members on the ward, and they'll be in charge of managing the day-to-day running of that ward. The list goes on, but the main point is that while speaking of both professions, you should comment on their similarities and their differences, but say it in a way that you would prefer the role of a doctor. You need to be careful not to be caught out degrading or giving false information about the other profession. There are certain phrases that you can use, such as more likely, can be, and this might be better than saying absolute phrases, because nowadays many healthcare professions share similarities in patient care. The multidisciplinary team. Some examples of the multidisciplinary team are listed. Think about it if you've observed any of these professionals during your work experience. What aspects of these careers have interested you or influenced you more towards medicine rather than observing them? The following list is a brief summary of each of these careers. Remember, the work they do is often not able to be simplified into a few key points, and their role will be much more expansive. But for the sake of time, we'll cover the main aspects of their role below. So nursing, as discussed in the previous slide, nursing encompasses many aspects of patient care. Often they will know the patients best during their admission. Their role involves patient care, personal care of the patient, ensuring that they're being looked after on the ward, that they're in charge of ensuring that patients are given medicines as they are prescribed, that they're washed, that they're fed, that they're monitored in their observations. They're also fundamental in identifying sick patients which need further assessment. They can often also do clinical skills such as blood taking, putting in cannulas and catheters, and they're also involved in the management of the ward. The role could include advanced nurse practitioners. You can read more on this, but it's usually involved prescribing for patients and more advanced clinical skills, etc. Healthcare assistants. They are involved in the care of patients on the ward, so feeding and washing and cleaning the environment. They're involved in monitoring observations of patients, and some can also do basic clinical skills such as blood taking. Pharmacists have extensive roles. They are mainly involved in making sure that patients receive the correct medicines. They will review medicines that patients are admitted to hospital with and make sure that nothing is omitted. And they're also available for advice on any new medicines that have been started and how these might interact with the other medicines that the patient takes. Some will have specialist or specific knowledge, such as in oncology or pediatric medicines, and some will have the ability to prescribe as well. Occupational therapists, they are involved to ensure that patients will have an appropriate home environment after their discharge. Their role includes, but is not limited to, assessing patients' cognition and identifying if there's any needs with activities of daily living. Physiotherapists, they also work within the multidisciplinary team, and they'll often identify any physical limitations of patients, and they're extensively involved in patient rehabilitation. Social workers are another key part, and they are involved in the welfare and safeguarding of patients. They will often help secure appropriate care needs for patients when they're discharged from hospital. Doctors are responsible for the medical needs of the patient during the admission, ensuring the overall care needs are met, and this usually involves closely working with the entire multidisciplinary team. The ward clerk or receptionist, they're important for the day-to-day running of the ward, and they're important for communication between different teams and team members. Dietitian, they can help identify any areas of nutritional deficit within patients, and they can inform how supplements, etc., can be beneficial in patient care. Remember, especially in elderly patients, malnutrition is very common, so the input of dietitians is very important.